Sabinos, what is spinal bifida? Spinal bifida. I'm sure most of you have heard about spinal bifida. Spinal bifida is a birth defect. Is a birth defect, meaning that what they are what diseases or they are disorders that tend to happen inside the womb. You get it? They are disorders that affect your baby inside the womb. They are not disorders that affect babies outside the womb. You understand? That's why they call it what? A birth defect. Spinal bifida is a birth defect that in which what the spine and the spine and the spinal cord they don't develop properly. You understand? They don't develop properly, and this normally happen in the first trimester or in the early month of what pregnancy, in which the neural tube. What is neural tube? Neural tube, they are the one that later form the brain and the spinal cord. That is neural tube. You see this neural tube, normally they are supposed to be closed. But in spinal bifida, they are not what totally what closed. They are not properly what closed. We have three types of what spinal bifida. We have the occulta, we have meningocele, and we have what the myelomeningocele. The occulta. What is the occulta? The occulta is the less severe form of what the spinal what bifida. Sometimes it doesn't present with any sign and symptom, so no worries. The meningocele is the one in which what sometimes when you give birth to your baby, you find out okay, there is this fluid, this fluid like a sac filled with fluid bulging out in the back of your baby. But the myelomeningocele is the more severe one. You understand? Even the nerves and the spinal cord tend to bulge out in the back of the baby, and this can affect the development of the baby. It can affect learning. It can affect the way the baby tend to empty his or her bladder. You understand? What are the causes of this spinal bifida? The major cause of spinal bifida, which can be prevented, is lack of what folic acid during what pregnancy. If you don't take your folic acid as at when due, as prescribed, your baby might end up coming down with spinal bifida. You get it? So the other thing is genetics, certain medication, you understand, and even some diseases like diabetes, obesity can actually cause this spinal bifida. How do we prevent spinal bifida? Take folic acid if you are pregnant. Take folic acid if you are